morning, good afternoon, and good evening. Welcome to the 1690th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Dr. Santha Chandran, the homeopathy consultant, Kochi, Kerala, India. Homeopathy expert in managing infertility and female complaints with more than 1,500 cases of infertility, more than 40 years experience, winner of many awards, and the topic is male infertility. So on behalf of IFPH, welcome, madam. You can have the platform for the next 45 minutes, so please proceed.
Thank you, Dr. Manoj. Can you, is it, you're hearing?
No? Audible, please proceed.
Audible. Thank you, Doctor. Thank you, all the pillars of this IFPH, giving me an opportunity to give a my experience on male infertility. And I should say I am not an expert in this matter, but what all I can share, I am sharing my experience. That's all. First of all, I invoke my prayers for the great Master Samuel Hahnemann. I remember and thank my great parents who encouraged me to pursue the path of homeopathy, without which I am nobody today. I also remember my teachers who helped me to be a doctor to practice the divine art of homeopathy. I take this opportunity to thank our senior doctors, and last but not the least, my friends and family who helped me to be there to attain all the achievements in my life. And so my first experience with infertility treatment. Is it audible now, Doctor? Manoj, Doctor?
So yes. Audible.
Audible. During the last years of my course, that is DHMS course, I used to give free treatment to my neighbors. One day I happened to see a lady without kids, and she was much worried about this. She used to bring her co-sister's children to me for acute complaints. She was in her 40s, and then I encouraged her to take homeopathy medicine, but she denied, saying that she's around 42. But I was successful in convincing her, and finally she agreed to take medicine. I started with the uterine medicines like Helonius, Alatrix, and some acute medicines for her and Damiana, Neferlutium, and Ashwagandha for her husband. By God's grace, she conceived within 3 months. This was my first experience and experiment with infertility. After that, she introduced me to her relatives without kids, and fortunately, it happened successful. That is my path of this infertility treatment. Was 45 years back. So after that, I'm continuing this infertility treatment. I focused to the treatment for infertility. Then seminars, and I attended, and I could attend our most important pillar of our IFPH, Dr. Ismail Said's infertility class. I'm still keeping that diary with me for my consultation, and it helped me a lot for the treatment. I have a good friendship, few friends with me who we will consult each other. My friend Dr. Rama Devi, my friends Dr. Annie, 5 friends are there. We used to consult each other. to the difficult cases. My friend used to tell, infertility is not a curse, it's not a disease, and they are not sick, but heart sick. And they may be mentally, physically, socially, and sometimes financially worried. So all these factors have to be considered and dealt gently. As far as this male infertility is a hazardous section. And I'm narrating my experience. There may be different opinions, but please forget, I'm not a single medicine holder, and I give constitutional medicine, organ medicine, and a few tinctures also I used to give. And in my beginning of my practice, nearly 45 years back, that time that ultrasound scanning and too much investigation not was there. Then the infertility couple used to bring so many files of normally, or in all cases, that females are more treated. And after that, too much lab investigation, everything, DNC, first of all, the gynec section used to do one DNC for conceiving. So after so many treatment, then last only they will check the male partner. But I used to do first investigation to the male partner. As in any, my method, okay, not my method. Okay. As in any clinical case, proper case taking has to be done. In infertility also, all details regarding their occupation, food habits, addiction, drug intake, past history of STD, family history, sexual habits, personal and emotional problems, besides the exact nature of sexual problems should be inquired. This gives the clue to the problems. Nowadays, this modern boys, modern life, IT field, give more, we are getting more infertility, male infertility cases from the lifestyle disease. So what are the causes of infertility? First, we will discuss that is structural complaints, structural defect. So this what I say, anatomy, physiology, and everything, anatomy, physiology, pathology, and lab, even lab investigation, everything at your fingertips. But my experience I am sharing. So this structural defect means anatomically the small testes or atrophy testes, atrophy penis, that should be considered first. Then for that we have, for atrophic testes, all iodide medicine I used to give. Iodine content, kali iodide, aurum iodide, for atrophy of testes. And for atrophy of penis, we have ignatia. For this structural defect, I and my friend Rama had a very good experience. That's years back. We were treating a patient with infertility. For at least I treated for 1 year. And that time, that ultrasound Doppler scan was not that familiar. And after 1 year, I asked that patient to do the semen analysis. Still, there is no sperms. Then I asked that lady, see any changes you have. Then that wife told, doctor, that bag, nothing is there in that bag. So there was absence of testes. And for my friend Rama had an experience. She sent to that urologist, and to that for 1 year, she was also treating a case for infertility, male infertility. And he also had no testes. then how can it be after giving so much medicine? So we nowadays, nobody will have such experience because advanced investigation that Doppler scan, everything is there. We can go through that. Then second one is for investigations is like all investigations, general medical history, routine investigation, sugar, semen analysis, hormone test, serum, FSH, LH, that all everybody know. So I'm not going through that. So first and foremost, investigation is semen analysis. In semen analysis, volume. First, we will see the volume. So if the volume is low volume, decreased semen from seminal vesicle can be due to a blockage, and I forget to tell, whenever you do a semen analysis, there should be 2 to 3 days absence should be there, and you should advise the patient not to do frequently, because 72 days is the 72 days is the maturing time of the sperm. So you should do only after, you should repeat the test only after 72 days. And when you do that semen test, there should be 2 to 3 days abstinence. The volume will be less because of any fever, low hydration, and blockage like varicocele, so many other complaints, as everybody know. Then color of the sperm. Color means volume less because of repeated intercourse. Also, you can have volume less. And color means normally is off-white color, and red or brown color is presence of RBC. Here you can give the medicine arnica, bellis, coneum, and yellow color is due to pus cells. So that we will have pus in urine, pus in sperm, semen, that we can correct with pyrogen, Merxol, Thuja, such medicines. Then comes the motility. Motility is oligospermia. For that, we should go through the more investigation. If motility is less, and in esospermia, we should do the investigation like hormonal investigation, and biopsy also you have to do if it is esospermia is present. If there is presence of absence of sperm, you have to do a biopsy test also. Biopsy also, one biopsy is not a confirmed thing. As our friend, one of my friend used to tell, say one, we should, for biopsy, we will take only one pinpoint the tissue from the testis. But there are, the testis is other place also there. So when you take the particular place, if there is no sperm, so you should not confirm that cell, that is esospermia or no spermatogenesis. You should not. So you have to do repeated biopsy test. Then count. Then liquefaction time. Liquefaction time. Normally it is 30 minutes for liquefaction. Then if it is too much time, if you take the liquefaction, there can be, the reason is prostatic infection. You have to select the medicine for which act on more in prostate gland, like Sabal Cerulata, Tribulus, such medicines. Recently, I had a very good experience that liquefaction, one patient came with 6 years infertility case, and they were advised for IVF, and he brought the semen analysis report. It was liquefaction time was more than 3 hours. And in all the cases, by case taking, I came to know that his wife told me, see, doctor, we should go to the family history also we are taking. So that wife told me she's the only daughter and now they are staying in her house. Then I asked her why you are staying here. See, my husband had a big fight with his parents, and for the last 5 years they were not talking, and I'm feeling very bad, doctor. Though I am a single daughter, single child, I don't want to stay in my house. I want to be with in-laws in in-laws house, and I don't have any grudge or anything with my in-laws. Then counseling him, I told him, see, he is not a person with a, what to tell, apologize. He won't say sorry. Sorry is not in his, what to tell, Rama, tell me. No, sorry, he won't say sorry to anyone. And we have a medicine, no, never moved by apologize. So I gave him acid nitricum 10 3 doses for 3 days. And I told him, see, your mind is so hard. That's why your semen is so hard. So hard. If you want to get rid of, you want a child, you come down at your parents. So you are trying to get a child. So you should go today itself, you go and meet your parents. Nothing wrong with that. And with a hard convincing with his wife, they went to meet his father, grandmother, everyone, and they were very happy. Now, and this very next month, she conceived. That's and this is my recent report, and I am also very counseling, convincing that boy. And now, today she came with a scan report, say 8 weeks pregnancy with a heartbeat. So that patient's semen report was no motive. You can think, no, 4 hour, more than 4 hours liquefaction time, there won't be any sperm, no motile sperm. That is my experience with that liquefaction. And for liquefaction, more I used to give, not only I and my friend also used to give, we used to give Medornum tennum, and all constipation remedies are useful for this liquefaction, to make liquefaction. Okay, correct. Then comes the morphology. I used to tell for semen analysis, I used to send the patient to a infertility clinic. Here, luckily, I have got an infertility clinic. I talk with the doctor in charge, and he is taking all my cases for that semen analysis. So that is an IVF center. IVF center, only in IVF center we'll have correct morphology. We'll have 300 million semen count, 300, 400 million, but that mortality will be 60%, 80%. We'll get a report, morphology 80%, 90%. But you won't have that much morphology. Only that maximum morphologically normal sperms will be only 14%. So normally that will, I am getting the case only 1% morphologically normal, 1%, 2%, like that. Such cases, we have to give syphilinum. Syphilinum tennum, weekly, some 8 doses I used to give. Morphologically normal. When morphology is very less, syphilinum tennum Then DNA 200, and ginseng tincture also I used to give. Our Padmanabhan doctor used to tell ginseng ginseng is a good medicine that act in stem cells. So that's a syphilitic miasm morphology, less morphology. So we used to give syphilina. Then come pH, acidic sperm, that all we all be knowing. And regarding fructose, you will be knowing. So pH is too much, we have to give natrum phos. Okay. High and low volume sperm, selenium, acid phos, acid picrincum, lysine, graphitis. Selenium, you'll be knowing this, all these symptoms you will be knowing. And lysine and acid, lysine and acid fluor is have perverted sexual act. Selenium, acid phos, acid picrica. Thin and fluid watery semen, cannabis sativa, natrum ore, natrum phos, selenium, and sepia. Thick, highly viscous, this thing. Kali bike also is very good remedy. All have different opinions. Please forgive me. This is what I am doing. I myself, my friend also, Rama also doing. We discuss each other, and that's why I'm telling I and my Rama is doing such medicines. You can, there will be different opinion. You can add or you can deny this our experience. There are like, these are all the medicine. Spermia, complete lack of semen with ejaculatory orgasm. This is the morphology. So you will have morphologically normal sperms like this. This is only morphology. You will have pinhead, double head. This is very important. And my beginning of my practice, I had a very good lab technician near our North Railway Station. I went and he only helped me to see this morphology. He showed me only where you have at least 1 to 4% morphologically normal sperms, then only you will have conception will be easier. Thiocyanum, also very good medicine. And Feltrari, I usually select when the person is, those who have gallstone, such complaints, I will select that one. And graphite is also good remedy, that when during intercourse, if there is no semen, no sperm coming, that time you can select graphite is a good remedy. Also, you can have that agaricus is good remedy. Calcarea floor. Hormone level, as a hormone. When FSH and LH low, that is pituitary defect. Low FSH and low LH, there will be pituitary gland defect. So here we can select the remedy pituitary 30, corneum, and apis. Here I am narrating all these medicines, all which I tried and we got result. That medicine only I am suggesting here. When testosterone is low, you will have all dead sperms. For such cases, we can give senecio, cantharis, ustilago. Ustilago should be selected when there is a history of masturbation, too much masturbation. You can select ustilago along with the platina and agonist castus. Will be so many medicines are there. And vanilla is a good remedy that will act on sexual organs and brain. It's a good remedy, vanilla. And to correct hormone imbalance, our sulfur calcarea, lycopodium, that is, I have got good result with sulfur calcarea, lycopodium. Then immunological test, that is torch test, anti-sperm antibody. And now for few more medicine I didn't no PPT, but I can tell few more. Should I tell the medicines or doctor or case should I narrate? What you suggest?
Yes, according to your wishes.
For oligospermia, you can start with tuberculina 10 and X-ray 200, Ustilago tincture, and for oligospermia. That those who come from the radiation and all, you can select first radium bromide. And very, very important cause is varicocele. Varicocele, we used to treat with first grade, second grade, third grade. Usually we are getting varicocele with a lifestyle disease. Lifestyle disease means IT field people, those who sit sedentary habits, and drivers, those who work in hot places. Example, traffic police people, drivers, IT, food, bakery, and such places, those who are working, you will have that to varicocele. So we have to advise them to loosen their clothes first, then Swiss bath. I got most result with those drivers. I got result with Naxomica CM. Then Arnica, Calcarea floreum. Then Aesculus tincture, Amamelis tincture, Calcarea fleur, and such medicine. But you add your own experience. Habits, you can have lysine and acid flow. With that also you have azoospermia, oligospermia, teratospermia, everything will happen with the perverted sexual habit. Then I didn't say that these are all pathological defect, and then come to our ED, ejaculatory complaints, or erectile complaint. Erectile complaint also more and more nowadays with this drugs that nowadays the boys wearing tight jeans, clothes, and that drug addiction, smoking, too much driving, bike users. We are getting such cases more. We are getting. I thought we are also giving accordingly to the situation. So I'm telling few medicines. Dogs is said, Dr. Ismail said, that after love marriage. Now it is very familiar. No? Love marriage come from so after love marriage there will be no love. So that boy will be in a high family, or the girl will be a low family. Such cases, too much suppression of the complaints. So too much suppression they will have. So they will have erectile complaints, and there will be, with the erectile complaint, you can have low sperms, necrospermia, oligospermia, everything. Such cases, Dr. said, sir, suggested Staphysagria. Staphysagria give me very good result in so many cases. That's sets us points. And where there is too much love, whether love marriage or arranged marriage, the person will come. When the person come, doctor, it's okay, we are trying. If you can do something, person will tell. If patient will tell, if you can do something for us, well and good. If otherwise also, we are happy. So we can make out such cases. Sets are suggested matrimony for both, for husband and wife. And I got good. I'm not giving only matrimony, but according to pathology, I'm giving the wife her medicines, Alatrace, Senecio, according to her menstrual habit, leukorrhea, everything we will see. Anticoital disorder, everything we will see. That is it is, whether it is correct or not, my constitution, I am giving such medicine. How I select one remedy, one or two medicines with one or two symptoms. When arsenic album comes, the person will always be a politician with he'll be wearing your white dress, white, very neat and tidy, and that he'll be money-minded person. And here we used to select arsenicum album. And bromium, one more medicine I'll tell. Whether is it helpful for any people, I'm happy. How I select the medicine, I'm telling. In bromium, we used to select. They are lazy persons with the blue eyes. So such persons, those who have such persons with the esospermia, erectile complaint, or such complaint, that constitutional remedy is bromia. And once we attended Dr. Rajan Shankaran's seminar. So there, Dr. Shankaran, there was one live case taking. Then that time, both husband and wife came and sat for case taking. And husband's symptoms are all narrating that wife is narrating everything. And husband is looking at the lady. Okay, she's narrating all her husband's problems. And such cases, for both, we will give Barretta curve. Whether it is oligospermia, esospermia, or erectile dysfunction, solution remedy will be Barretta curve. And Costiga, very beautiful social worker and politician. Costiga, other complaints, other symptoms will be better. And Cornea, also easily intoxicated and strong, fatty. There will be sexual urge will be very less. Cornea. Dull camera is a self-made person. they want respect from others. You respect me. I'm self-made. That's my concept. There you will have different opinions. Sorry, my concept I am taking. Graphitis is very hard-working person. And no complaints. They are mental labor, physical labor, there is no complaints. And with the skin complaints, and there will be constipation, with erectile dysfunction, there will be with during coition, they won't have semen, absence of semen in graphitis. Ornament is a royal look with a slum behavior. With a royal look with a slum behavior is ornament. Not only that, depressed, like ornament is very good remedy for depressed, that infertility person comes with the depression only. So many cases, last I think in our IFPH in class, IFPH ceremony in Hyatt Hotel, Trivandrum, our 1000 days ceremony, I got a case with I treated with ornament, only ornament I gave. With that, second month they conceived. Both the couples were put in hostel from their childhood. So they are both of them depressed and very, very badly depressed. I gave them only ornament and plus that acute medicines. And eupatorium pulp is very, very, very good remedy for erectile dysfunction. Eupatorium pulp, mother tincture is good. When sepia man comes, he's Chandapottu, we will tell. Sepia will be mentally womanish. And for erectile dysfunction, no sexual desire, sepia is very good remedy. When Surya gave me, sometimes we will forget when the patient is in front of us. That time we will be calling Rama, Surya, so our friends. She suggested sepia with that erectile dysfunction was much better. Sulfur ladies with beautiful eyes. I take only 2-3 symptoms for the constitution. And Pulsatla is modest and selfish person. Phosphorus, our James Paul's doctor gave me one class, gave us version. In this, his narration also is there. Phosphorus is a see-through person with a long dress, obedient person, very loving and obedient person. And in infertility, we have very good action, that argentine nitrate, gelsemium, so many medicines we have, very good medicine. And thank you for hearing me. There will be different opinion and I need your suggestions also.
Okay,
Thank you, doctor. Thank you, doctor.
Don't be doubtful. You're always doubting about whether others will observe his confusion or something. That's I think some medicines and the material. There is no need of such apprehension or anticipation because homeopathy is a elastic science. A lot of medicines, a lot of philosophy is there. The Games method is there. The Richard Hughes method is there. So many methods are there. Crompton Bundles are another methodology.
So many methods are there, yeah.
No problem. Everybody reasons to a single point. It's time for discussion. Those who would like to participate, please raise your hand. And of course, your close friend and our Honorable Lamadevi doctor is there. Yes, madam, your opinion, please.
Hello, good evening, everybody. It was a very nice session. You have explained nicely, Chanda. Very nicely you had explained.
Thank you.
I don't have any doubts.
Yes. It's a really a complementary relation between the Santha Chandran doctor and Dr. Ramadhi, but always maintaining the relation. That's also good. Now, Dr. Srinivas, please unmute. Yes, please.
Madam കേൾക്കാവോ?
Yes,
Yes.
please.
Madam, ഈ anti-insulin antibody is nearly 800. അവിടെ നമ്മൾക്ക് ഇപ്പൊ എന്ത് ചെയ്യാനാ പറ്റുക? Anti-insulin antibodies 800. പേഷ്യന്റിന്റെ പ്രോബ്ലം എന്താ വെച്ചാൽ ഇതുവരെ കൺസീവ് ആയിട്ടില്ല. Nearly 27 years ആണ്.
Dr. Srinivas, could you please sit in English? It's an English session. Don't forget. Dr. Srinivas, please unmute.
Doctor, you can try pancreatin 3x.
Pancreatinum 3x. Okay.
Yes.
Would you please-
Under what frequency, madam? Daily, I mean, 3 times?
Daily, twice or thrice a day.
Okay, and how about this insulin 200 or insulin 1M?
Insulin one also good, but I start with creatine 3x.
Pancreatinum 3x. Okay,
3x.
okay, madam. Okay, thank you.
Okay.
Thank you for participation. So yes, if anybody is there would like to participate, you can add your opinion. There definitely the discussion is the main key part of the IFH program, and we should always maintain discussion in exchanging the words and views. Now, Dr. Sadar Seth is there. Yes, Dr. Sadar, please unmute. Yes, please.
Good evening, ma'am.
Good evening.
It's pleasure to see you giving such a lecture in English.
Thank you. Thank you.
Most of them we have heard it, but I was just wondering and I was just enjoying the talks and the medicines you have been giving. And we call up every time to Dr. Santha to get all these details. Infertility, we call her up for every little things. And today also no difference. She has given out everything. The best part is that she doesn't hide anything from this one. And I think I have the slide also with me.
Yeah, you have the slide.
I
I
have
gave
the
the class
slide.
in the Topambadi for
Yeah,
Q5.
the full slide is also with me.
I forget to tell one very, very, very important medicine, carcinosin.
Huh.
That in Hindi section, the doctor narrated very beautifully carcinosin. And carcinosin comes now that modern couples, carcinosin is very good for infertility also.
Okay. So medicine of this era. Okay, thank you, doctor. Now, Dr. Sanesh, please. You can unmute Dr. Sanesh.
Yes, Dr. Santha Chandran, madam, it's really a very good session indeed. Though there was some starting trouble because of anxiety of whether I can, whether the slides can be shown or not. I was trying. Dr. Hubert was about to upload the slide. Then all of a sudden, yours from your side itself, you were able to upload the slide. That's why the confusion raised. Anyway, it was really an excellent session, and definitely you can come up with some more presentations so that next time everything will be in perfect.
Thank you, doctor. Thank you.
Then the other session we can go ahead is that female infertility next time. You are an expert in that field also, because there are more than 1,500 cases, successful cases with you, and all of them calling you as mother, and just like your friend Dr. Ambadi. Both of you are doing excellent job in creating publicity for homeopathy also, because this is what we are expected to do to the people around the world also. Anyway, congratulations once again, madam.
Okay,
Thank you.
Dr. Sanesh. Dr. Indranil, yes, please. Another true professional in our platform. Dr. Indranil, please.
Madam, actually the information which you gave was very nice and it was very addition in our knowledge. Here what we see that in male infertility, many times I have seen that people have past history of repeated months in males.
Mums,
So those are-
in such cases, we can give pyrotic. Parotidinum 200. we can say.
Parotidinum. So for such cases, should we open up the case with parotidinum or should we go for a pathological prescription? What will be your suggestion?
My suggestion is I used to give sulfur 50 m first.
First 50 m. Okay.
50 m. Sulfur 50 m. That
But-
trimiasmatic.
Trimiasmatic. Yeah.
Calcarea carb 50 m. Lycopodium. 50 m.
Okay. Okay. But
Then
actually,
Sinili, 3 doses. And parotidinum 200 daily
Okay.
for 1.
Acha. But if the
And
patient
to
is
find out whether that
low-
comes that any atrophy in that testis or not. And they must have done biopsy also. If there is maturation arrest, you have to go for, instead of sulfur calcarea lycopodium, if they have done biopsy, and
Okay.
you have to go to Medorna first.
Okay.
If there
Okay.
is maturation arrest, Medorna. Then you can give parotidinum pulsatilla like
We can open up the case with a nosode, no? That
Nosode, yeah.
We have to open up the case with that.
Open up the
Okay.
case.
Okay. Thanks for your guidance, madam. Thank you.
Thank you,
Yeah.
thank you, thank you, thank you.
Yes, thank you, Dr. Daniel. Now, Dr. Srinivas, please unmute. Dr. Srinivas, could you please unmute?
Yeah,
Yes.
madam, you can hear me, right?
Yes,
Yeah,
yes,
yeah.
no problem, please.
Yeah, madam, one small doubt. See, usually this we give this pituitary 1M, ovary 1M, and the constitution remedy. Whether this constitution remedy should be given before ovulation days or after ovulation days, and how about this pituitary 1M and ovary 1M? Whether it has to be given soon after menses or at the time of ovulation days.
Yes, next.
Pituitary, this is a female infertility problem. And so now we are discussing male infertility. So still, I'll tell you, if that pituitary and ovary, when we are selecting, if there is no ovulation, you do the ultrasound scan, follicular study. If the ovum size is very less and the hormonal level is, if that prolactin is very high, then only we will select pituitary 1. According to that, you have to go through the hormone assay. Then we will select. So blindly you can't give pituitary 1 and ovary 1. And I won't give that way. I will see the follicular study first. The ovum is very less, and that hormonal assay, we will find out FSH-LH ratio is not proper, and that prolactin is very high. Then only we will give pituitary 1. Pituitary 1, 10 or 30. That according to that pathology we will select.
Okay, madam.
Thank you,
Okay,
doctor.
okay.
Okay, thank you.
Manoj, can I tell one
Yes,
thing?
yes. No doubt, please.
See, Dr. Srinivas, I have got another experience. See, if it is any hormonal change or anything like that, we can give hypothalamus, pituitary, testicular axis. Understand? Hypothalamus.
Testis.
And in female, we can give hypothalamus, pituitary, ovary. That you give continuously. Understand?
Yeah, okay, madam. Okay,
Shanta, both of us are doing that. That's why Shanta would have forgotten. That's why I'm telling.
okay, madam.
Yes, that is why I told this is a problem act. Please.
Then, if in female cases, if FSH is reduced, we can give FSH on 5th, 6th, and 7th day, and LH on 13th, 12th, 13th, and 14th day. Sorry, 11th, 12th, and 13th. FSH.
Yeah, okay, madam.
Okay.
Okay.
Yes, very precise.
Doctor, I want to tell one more case.
Yes, please.
See, when this Ganesh doctor told me to take the class, I was just going through my previous old case sheets. So I find a case sheet that's Sertoli cell syndrome only. That is very difficult to cure. And it's itself that ICSI or IVF with the donor sperm is suggested nowadays. But I had a very good result with in Sertoli cell syndrome. That is, I have given knowingly or unknowingly, that time I gave sulfur 50 repeated dose once in a week for 3 months. For 50 3 months. That is we take medicine, 1 drop, then you titrate. That's the first dose. Again, you add sugar of milk, titrate 10 times. Next, you take, that is the second dose.
Can I
That way,
explain, Chandra?
I gave it for
Can I explain
3
it?
months. Yeah, but let me finish this. And it inaugurating. It gave me wonderful result. He's having 2 kids.
Yes,
And,
madam, please. What is your...
The pressing method,
Very
Shanta is telling
difficult
that,
case for to cure, that's all. Yeah. Yeah.
and that is
You tell
we do pressing method. She told no sulfur 50 3 months she gave. Only 3 drops we are giving, and we are giving it in pressing method. Understand?
Okay.
Not daily 1 drop. Only 3 drops. In pressing method only we used to give.
Yes, we must remember always that the dosage of homeopathy is a revolution in the medical science. That's the most important thing. Just really brought, invented by Dr. Samuel Hahnemann. Yes, when you would like to participate, Dr. Ram Parvesha, another experienced person with a strong voice, sir, please.
Our Hariharan doctor is not there. I
Yes.
couldn't
Thank
see.
you. Thank you, Manoj ji.
Thank
And congratulations, Dr. Santha Chandran, madam.
Thank you.
Very nice presentation. Excellent session. Could describe the atrophy of testy and
Thank you,
other
doctor.
cases. Very,
Thank you,
very
doctor.
thanks. Very good experience, madam.
Okay, thank you, doctor. Thank you, sir.
Mathematical angle treatment, calcarea and lycopodium, etc. So very nice, very good remedy for hostility. Very, very thanks, madam. Thank you.
Thank you. Thank you, doctor. Thank you.
Okay. Madam, what about the use of this DNA?
DNA for necrospermia and abnormal teratospermia, we have to give DNA. That is giving good result.
What about the application of DNA apart from this?
DNA, we at least 1 month I will give daily 1 dose.
Okay. Yes, Dr. Manohar, definitely they will upload all these things in the YouTube. You can watch all the programs on YouTube. In coming 2 or 3 days, it will be uploaded. There's a question from Dr. Manohar, whether it is upload recordings available or not. Yes, definitely. When you mentioned about this case of mumps, how it is treated, recently a lot of cases are coming, even though the preventive measures are on, but it often fails, and a lot of children, not only children, but always adults are affected recently with this case of mumps. That's also very important. And homeopathy is a lone science which can treat all these cases. Then you mentioned about the factors that to be identified in the semen analysis, this volume, color, motility. Definitely it's a wonderful science because we can have all options for treating such cases. And you mentioned about this, the interval between 2 laboratory examinations, 72 days, the scientific explanation why stick on this 72 days, that's also very important. Otherwise, the patients, without the awareness, are always testing and will fail. No doubt about that. It's time for wind up the session. May Dr. Sanesh to express a lot of thanks, Dr. Sanesh, for taking all the stress and strain to continue to conduct this program uninterrupted. Dr. Sanesh, please, are you there? Dr. Tanesh. I think he's not responding. Definitely that. Then you'll go to Dr. Indranil Bhav, they conduct some service.
Sure, sure. Yes, madam, on behalf of IFPH, we really extend our heartfelt gratitude to our esteemed speaker, Dr. Santha Chandran, and for sharing her insightful perspective on this difficult topic of male infertility. Your expertise has truly enriched us with a good understanding. I also thank the attendee who have asked questions and cleared their views. So kindly accept our gratitude, and we hope to meet again in future for some other lectures from you. Thank you, madam.
Definitely, these two fellows has got a lot of information along there. As rightly mentioned by Dr. Ken, things will grow brighter as minds are brought together and men think harmoniously. The more we keep together, the more the better. So they are always in tandem working each and every case. They are also getting good results. So now that is also an appreciable move by these two genius ladies. No doubt about that. I am saluting them. The remark, let me conclude today's English edition. And would like to remember one thing. In the 27th of this month is the 1,700 days of our continuous webinar. So there's a special program in that on the Sunday at 8:30. So I appeal all of the participants to participate at the program also. So with that, that's all for today's edition. Hope you will be back again tomorrow. Till then, goodbye. And Dr. Shaila to continue the program in Malayalam. Thank you.